Just last month, Lisa Marie Presley, daughter of Elvis Presley, died of cardiac arrest at the tender age of 54, further shining a light on cardiac health among women. Well, joining us is Dr. Ann Kroman, cardiac electrophysiologist at MUSC. Great to have you with us. So this is a good time for us to focus on our health, specifically heart health. So we're looking at women. How common is cardiovascular disease?
Sure, absolutely. Cardiovascular disease is very common amongst women, and while we do see a higher percentage of cardiovascular disease in men over women, however, a concerning factor and a concerning statistic is that women actually have a higher morbidity or mortality, meaning that they have higher kind of life-threatening complications and a higher life impact from their cardiovascular disease when compared to men.
And why is that? Because it kind of flies in the face of, men never go to the doctor. Women tend to go all the time. So why are they detecting this disease too late, or?
Absolutely. I think it's a variety of different factors, and something in medicine we're trying to really hone in on and figure out. Probably a couple different things, including women can present with different type of atypical symptoms from their cardiovascular disease or cardiac arrhythmias, which can lead to the diagnosis being a little bit delayed or put off. We're often also noticing that women have less aggressive treatment, both of their risk factors that are underlying risk factors that lead into cardiovascular disease, as well as potentially less aggressive treatment of the actual cardiovascular disease itself.
And amongst other diseases that affect specifically women or predominantly women, such as breast cancer and other types of illnesses and diseases, are we more focused on those things than we are of the heart? Do we just take it for granted?
Absolutely. And even when we look at all those other diseases that we think are women specific overall, we tend to see that if you look at all the causes of death amongst women, cardiovascular disease is actually the highest. And that's why really we're trying to have February be Go Red for Women Month to really bring in attention, especially to our women patients and our women population, about how vitally important taking care of their cardiovascular health is.
Is there one demographic over another that is more affected, less affected?
Sure. When we look at overall cardiovascular disease, it's really important for women to understand the underlying risk factors that can lead into very serious and life-threatening cardiovascular disease. And again, those are going to be hypertension, diabetes, sleep apnea, or anything that involved their pregnancy as well. We also see women who suffered from hypertension during pregnancy or gestational diabetes, even after the pregnancy period, that can affect them further down the line.
And how does it present in women versus men?
Sure.
So how are there certain signs that women should be paying attention to that will send them to the doctor?
Sure, absolutely. If we look at overall heart disease, such as heart attack type pain, women can present with very atypical symptoms, including just generalized discomfort, feeling of being unwell, shortness of breath, having trouble doing their daily activities. If we look at cardiac arrhythmias, such as atrial fibrillation, women can often present with just feeling fatigued. They can sometimes have these palpitations, and again with those kind of decreased level to do their normal activities.
Yeah, so you shouldn't take it for granted. Don't just think that you're tired or feeling a little sluggish. It might actually be a prompt for you to get to the doctor's office.
Absolutely.
And is it reversible?
Yes, with good, yes,
or?
absolutely. Lifestyle modification is a key factor for both heart disease due to blockages in the heart arteries, as well as for heart arrhythmias and reducing those burdens as well. So I think kind of prompt attention, being in tune to our own bodies, being advocates for our own health, as well as taking charge and really working on modifying any risk factors at home that we can.
Yeah, indeed. And for people who typically have a pretty healthy lifestyle, can this be something that's hereditary? Can it just be passed down through genetics?
Yep, absolutely, absolutely. So and that's why it's good to stay on top of your health, have good health screening overall, cholesterol, blood pressure, blood sugar, as well as if you're feeling any of these slight side effects or any of these kind of symptoms, anything that's of concern, definitely speak to your doctor right away.
Okay, sounds good. Thank you so much, doctor, for coming on and sharing with us.
Oh, you're welcome.
To your heart, everybody. Happy Valentine's Day. We're back after this.